So I'm Gary Rowe, the CEO of Safety Action. I've got on the slide there and Katie Webber, but Katie's unwell today, but I'll be joined shortly by Stephen Webber, and also Andrea Rowe will be joining me for part of this morning as well. So let's kick off what I'd like to cover with you this morning. Steve's going to talk to us about the code of conduct and how that fits in with safety systems. I'm going to talk to you about what OHS can teach COVID, which is rather interesting with the New South Wales flare up again. Swims and confined spaces. Steve will talk to us about our benchmarking survey, which we're running again this year, 2021 version. Because of COVID last year, we did not run this. So this is now running out to about 2.5 years since our last one. And I'll mention at the end a workshop that we'll be running shortly on risk assessments and also swims. So I'll turn to what does a code of conduct have to do with safety? And I'll just turn to Stephen Webber. Stephen, welcome. And you'll need to turn your mic. Oh, you got your microphone.
All good. Thanks, Gary. And good morning, everybody. Great to be here. So in relation to the code of conduct and why we think it's important, recently we're seeing a lot of movement in South Australia and other states like Victoria, who are just reinforcing their focus on sexual harassment in the workplace, bullying, and other forms of harassment or aggressive behavior by workers. It's very clear that the regulators and the government is taking the attitude of proactive management in this space. It's no longer just enough that you have a policy somewhere, you might train everyone now and again. Like other risks within the health and safety spectrum, they're really doubling down on you must proactively seek out these risks, these hazards for sexual harassment, bullying, etc., and manage that. And one of the great ways of starting and building on this is the code of conduct, because this is a really concise document that says not only what your company vision and values are, what they stand for, but those critical elements that they cannot abide as violations. So sexual harassment, drugs and alcohol, etc. Those critical safety standards of you must be licensed and authorized to operate plant and equipment. These are the critical rules that exist within your business for things that you as a business cannot allow to occur. You don't double down and put all your policy back in this document. It is just simple statements of the critical elements of those procedures. And we must make sure that this is communicated, enforced, instructed with the staff periodically. It can't just be one-off, it has to be repeated. Our managers have to be trained in not only to uphold and model these behaviors, but to test them, to engage on them, to reinforce and ensure that they are actually in place and being lived. And as part of that, we must make sure that staff are aware, if a breach occurs of this, what is the process that's going to occur? What are their rights and responsibilities under any sort of disciplinary process? It should be all open and extremely available for everyone to understand and access.
Steve, maybe a couple of questions without notice, if I may. Core safety standards, and you and I are very familiar, and many of our clients, with golden safety rules.
Yep.
Firstly, what percentage of companies that you've come into contact with have a set of core safety standards or golden rules? Is that a common thing, or is it half the businesses?
It's less than half. Off the top of my head, I'd be saying 20-30% of the people I audit or attend have these in place. It's a strange one that people recognize their value and understand, yep, I've seen that, and those are good ideas to have, but it just often doesn't get made into reality.
Yep. Yeah, my second question is, Steve, our standard set of template golden safety rules has picked up the traditional safety hazards and requirements, the rules. I'm guessing you'll tell us we'll need to update those to broaden it to include this wider spectrum of bad behaviours, which isn't just I've driven a tractor without a license, but in fact these are behavioural things interactions between people largely. Am I correct?
Yes, that's correct. Ours will need to be updated to clarify these processes.
Yes.
So we'll have to define what our drinks limits at work functions are, but yes, this is a rapidly changing place. I mean, mental health was only introduced in 2012 into our legislation or framework for health and safety. So 9 years is still in the term of a field is not a long time. But now we really have to understand this is here, it is present. We're starting to see codes of conduct, guidance material. So we need to understand that this is a proactive hazard that we need to manage for health and safety, just like anything else.
Fantastic. Thanks very much for that, Steve. If I may, because of time, really interested to hear the update on the benchmarking survey this year. So this is just the front slide, which we've got in our newsletter as well. I'll turn to our first slide here. How do you measure up? Do you want to outline for the listeners what this survey is about and the key components and how we operate it?
Sure. So we used to run this annually, but there's been, as Gary mentioned, a little bit of a break. The purpose of this was to try and help businesses understand where they place in terms of their safety metrics, to understand what their position is. Are they good? They're bad? How do you actually measure up? What does the values that you're getting in terms of your safety data actually mean in broader context? Over the last couple of years, we have also introduced a number of questions to try and link safety practices and so policies, procedures, activities that you do for health and safety to try and start to build a picture of what activities actually improve or contribute to a better safety record or metrics or result. That is still that is providing really fascinating data, and we're starting to see some trends developing. It will evolve as it matures, but we're also already starting to see what activities, if absent, correlate to poorer safety results and performances. So if you're interested in that data, let us know and participate in the benchmarking survey so you find out what those sort of information is.
Now, Steve, if I may, one of the ones I like, which is at the start of the slide there, do we have too many or too few safety staff? You and I know that even all of our safety friends are often interested in that within a business. Should I have more on my safety team or less? I think we're one of the few surveys that actually answer this question, aren't we?
Yes, we're one of the few that actually look at that data, what it actually means and correlate it to employee numbers based on working hours. We then are now linking it to, okay, what do people with higher value or higher ratio of safety staff to employees versus lower ratio, how does that performance actually look and measure up? And it does actually have a solid correlation that is quite interesting to look at.
Yep. So maybe, Steve, if you can just quickly take us through the process, just so the listeners and viewers today can see how easy it is to participate in our survey.
Sure. So I think it's a series of 20 yes/no questions and 10 safety performance lead and lag indicators. It takes less than 10 minutes for somebody to complete it. You don't have to answer every question or provide every bit of data. Whatever you have is great. Basically, it's a simple online, you can access the tool, you can request it to be emailed out to you, or you can access it off our website. It's kept completely anonymous. The only people that are going to see your company's identity is myself and Katie, who process the information. It will be provided out in a declassified or classified form, and only you will know which of your organizations are included on the final report based on your unique code. Yeah, it's really simple. And if you need any help at all or have any questions, we're always happy to answer and respond. Yeah, it's.
All right, thanks, Steve. So if I'm right, we've got a link in our current newsletter, and the next upcoming newsletter will have the link, so you can just click on it to enter. And I think on our website, yes, safetyaction.com.au, there's a link there. You can just click on that and enter the data. Am I correct?
That is correct. Yes.
Yep. And we will take it electronically, or if people want to print off the submission form, just handwrite it in, scan it, and send it back. We'll take that as well.
Yep. You can mail it in if you like, but then that adds like $1.40 of postage. So it's
snail mail.
It's no longer free.
Thanks very much, Steve. Okay, we'll move to our next topic, which is one that I've provided a brief article in this month's newsletter. And it occurred to me with these recurring lockdowns, we don't appear to be learning very quickly. And it occurred to me a lot of what we do in workplace health and safety, particularly in the arena of safety leadership, can provide us with some good tips and ideas for dealing with COVID restrictions and lockdowns moving forward. So I just thought I'd share some of these with you. So the first thing is good rules must have clear benefits. And what I've seen with some of the lockdowns, particularly earlier in Victoria, I was particularly dismayed when a young girl was fined by the police for out on the roads doing a driving lesson with her mother during one of, I think it was Melbourne's first lockdown. And yet they're from the same household. They weren't visiting anyone. They weren't traveling with anyone. There was no risk to anybody, either to themselves or to spread the COVID risk. So we would argue that what they've thought up is a rule that works, but it is not a good rule. So it's actually the health people say, yeah, but look, our rules worked. I can show you that the number of COVID cases went down. That's not actually the real test. You can be draconian with any rule and show it worked. But what the real challenge is in good safety leadership is what's the least amount of safety rule we can impose which will deliver the right and desired outcome. And so that's what this is about. And then I guess the second part is, so what do I do if I find a bad rule? And safety leadership training teaches us it is okay to challenge what you think is an incorrect or a bad rule. But what is not okay is to recklessly disobey it, and that is to expose other people to risk, like going out and having rage parties and lots of people around during a lockdown. Clearly, that's going to increase the spread. So this article and my opinions here are not about saying the lockdown rules were wrong, not totally. Certainly, isolation was important. But it's okay to challenge them, but not to recklessly disobey them. And another important thing that I noticed throughout this entire COVID thing is that politicians are saying, I am powerless. I have no choice. I have to take good advice from the health specialist. So what they're saying is it's not my fault. I'm applying these rigid rules to everyone, whether they're applicable to everyone or not. For example, locking down the entire state of Victoria earlier when we had no cases of COVID in the country areas. And so the country area people are saying, why are we locked down? Because Melbourne has actually got a problem. And indeed, it was well known that Melbourne didn't have a problem. In certain suburbs had problems. So, but I understand the difficulties in locking down suburbs compared to, say, Melbourne and a city. So part of what we're saying is politicians cannot abrogate their full responsibilities and just simply say, oh, well, I had to defer to health experts. So here's the thing about health experts. If you give somebody a single job, one single responsibility, they can introduce rules which absolutely will work. So there's no question that they don't work, but the point we're making is it's not balanced. Normally, politicians have to make judgments about how much to expend on roads, how much to expend on schools and hospitals, and balance this out with how much money, how much debt, competing priorities. If you give a health expert one job to fix COVID, they have none of those considerations. So inconvenience to the community, businesses going broke, mental health stress and problems in families and businesses and relationships is nothing to do with the COVID experts. They don't care. They've been given one job. And so what we're saying here is that this is not good safety leadership. And so safety leadership has provided us with a number of things that we can look to. I'll just share a couple with you. Number one, the 4-to-1 rule. So we want people to follow our rules. I can tell you the 4-to-1 rule is not a safety rule, by the way. It's a rule of human behaviour. And that is, you need 4 positives for every negative. So you need positive reinforcement when you want people to change behaviour and do the things that you want to do. And if we don't find we're getting that feedback at the ratio of 4-to-1, then people are less likely to actually follow it moving forward. Another principle of safety leadership is that every breach of your safety rule is intervened, and intervened immediately if possible. And intervened face-to-face, hopefully. That may be wearing a mask or social distancing, but face-to-face if possible, immediately. But also following the 4-to-1 rule. So people often think, I'm intervening, so I've got to punish or criticise somebody. But really, there will be people who either didn't fully understand, don't understand, or unable to comply. I've lost my mask. I don't know what to do. So in the article, I show an example. You tackle a person you believe should be using a mask, but maybe what you actually say is, I notice you don't have a mask. Here, take my spare one. That would be an example of applying good safety leadership principles, 4-to-1, positive feedback, but you're actually stepping in, you're not ignoring it, and you're not letting people get away with it. Every breach is intervened, but you do it in such a pleasant and constructive manner that people actually appreciate your intervention. That's the key of safety. That's what I thought safety leadership could teach COVID. So that was the purpose for that particular article. So hopefully you didn't mind my little descriptions and Gary Rowe's potted versions of that here. So at the end, our goal is to set good rules and have everyone to willingly follow them, not stand over them with a big stick. So that's what I thought good safety leadership can bring us. And just going back to one point there in that slide, don't ask officials what we can't do. What we should be doing is insist they explore everything we can do safely, but maintaining social distancing when that's required for things like COVID. And you'll see there in the photograph, people are not allowed to go out hiking. My good neighbour in the court where I live in eastern suburbs of Melbourne's a keen fisherman. He goes out with his family. He leaves at 3 a.m. in the morning down to the boat ramp out on Port Phillip Bay or Western Port Bay on their own, fishing back in the car and back home. Pose no risk to COVID spread, but we're not allowed to do it. And we know scientifically that spreading COVID outdoors is probably 10 times less risk. So we know it's less risk. So I'm wondering why we didn't allow people to go playing golf and other things. So that was the anomalies I saw in the COVID rules at the worst of Melbourne's lockdown. Maybe Sydney's now grappling with this in their own way. So I just thought you might be interested in those observations and my perceptions. So let's just turn to the next article. We had, I think it was a recent question in here, do I need a SWIMS for confined space entry? And the answer may be yes, if it is actually what you're doing, if it's classified as high risk construction work, which is prescribed by the regulations, by the way, so it's not my opinion. So first it's got to be around construction and there's particular risks involved, then it'll be high risk construction. So the answer would be yes then. If it's not high risk construction, because you might say, no, I'm not doing construction, I'm doing routine inspection, I'm doing routine maintenance, something of this nature. So in which case, It's not high-risk construction. SWIMS is not prescribed by law, but legally you still have to have a safe system of work, which normally would be in the form of a procedure for the task, but that procedure may be in the form of what you call a SWIMS. Somebody may label it a SWIMS. Nothing wrong with that. Nothing prevents you from using a SWIMS outside of high-risk construction work. So there's no regulations that say you can't. So you may well have that. Just as a final note there on that quick question, all confined space entry requires a permit. So the Victorian OHS Regs 63 and the WHS regs virtually everywhere else in Australia, bar WA, reg 67. So I just thought I'd mention that for you. So I'll just turn to Andrew, who's waited patiently. Andrew, hopefully you can hear us and see us.
I can hear you, Gary.
Yeah, do you want to just tell us about the new Victorian DG notifications?
Yes, so this is an updated requirement that you might have heard about in our news and in other WorkSafe news. They've said that they've strengthened the requirements for notifying of dangerous goods storage for prescribed premises. The good news is that the changes are actually quite small, and I'll just tell you a little bit about that. So firstly, a prescribed premises. A prescribed premises is a workplace that has dangerous goods in quantities that exceeds manifest quantity. So if you're not sure what that is, what you need to know is the total amounts of each class of dangerous goods, and then check that against Schedule 2 in the OHS regulations. And if you exceed manifest quantity, then this applies to you. If you exceed manifest quantity, you already need to it was previously every 5 years, you needed to complete a notification to WorkSafe, simply just filling out a form of the details of your premises and the quantities of dangerous goods that you hold at the premises. Years ago, it was a paper form that you would send in. Just in the last year or so they have digitized that form. And the new requirement is actually still using that digital form on the My WorkSafe website. So that's quite easy to complete. So the main change is that now it must be done on that digital platform. But instead of sending an update every 5 years, you now have to send an update every 2 years of your quantities. And previously, the law wasn't very specific about updating with changes. So they did say you had to re-update if changes occur, but they didn't give any guidance on what that was. And I was using around a 10% threshold. They've now actually clarified and said if your quantities of dangerous goods change by 20% or more, and they've given a list of scenarios for changes. So if you start to use dangerous goods that you didn't previously have before, or different uses, changes in your business's activities, you now legally have to give an update to WorkSafe within 3 days of those changes occurring. So it's still quite easy to do. And the other thing that's changed is it says that you also need to give more information, but that is quite small. All you really need to do is tell WorkSafe the approximate number of people that work at your premises. So really minor changes there.
Thanks, Andrew. And just a quick one. The update at least every 2 years. So even if you haven't changed quantities, you need to confirm that at least 2 yearly. Is that correct?
Exactly. That's exactly right.
Fantastic. Thanks, Andrew. Now, while you're online, I believe just on the next one, I think you mentioned the digital tracker was, so I didn't have that second slide up for you. Was there anything else you wanted to mention in relation to that?
Oh, yes, this is just a quick reminder for anybody that does transport waste to prescribed premises. So this is prescribed waste such as, asbestos contaminated materials and other prescribed waste that was all that you already had to do a digital tracker.
Yep.
And now it's just letting everybody know, if you're not already aware, that the EPA has moved to a new waste tracker system. So you need to be registered on that. So it's already started on the 1st of July. And if you were previously using the old version of the waste tracker, you do have to wrap up any of those outstanding notifications and finalize those, and have everything moving forward using the new EPA waste tracker system. So more details on that is on the EPA Vic website.
Thank you very much, Andrew. Appreciate that. So thanks, everyone. Before we wrap up, a couple of things, if I may. Coming up in 10th of August, we hope Melbourne will retain its clear situation with COVID restrictions, and we're looking to get back to face-to-face workshops occasionally. So I'd like pencil in 10 August. It's only running from 10 till 2:30, so we're thinking the middle of the day with a light lunch there. So it's really a half-day workshop on risk assessments and SWMS, safe work method statements. What we've found is these two areas in the whole of industry have created so much concern. There's so much rumour and myth around what has to go into a risk assessment or what doesn't, or what does a good one look like, or what does it achieve. And particularly with SWMS out on site, are people legally required to sign the SWMS every day? Does it have to have the initial and final risk matrix used for each step? All of these things we're going to answer. So if you're interested in transforming your knowledge and how you prepare and review risk assessments and SWMS for the rest of your working career, I suggest you consider booking into our workshop coming up in about a month's time. So before we wrap up today, I'll just next month, we're going to have a closer look at the Victorian on-the-spot fines, which have been announced. They actually kick off and commence potentially from the 20th of July this month. So if you're not careful, you may have incurred a fine before we tell you more about it next month. In short, Victoria's had the right to operate on-the-spot fines since 2004 with the original 2004 OHS Act. But the government is now choosing to roll out for selected breaches, things like lack of licence, operating plant and machinery without licence or certification, lack of supervision by businesses of workers, and a few other selected areas. We'll give you more details next month and in our newsletter coming up. We'll also update, Andrew will update our fact sheet on defibrillators, which I think was prepared a number of years ago. Technology's changing and work practices are changing. So we'll provide you with an update on workplace emergency first aid and defibrillators. So that's all we've got for today and this month. Thank you for joining us and your support, and stay safe, and we look forward to seeing you next time. Thank you very much. Bye.
Thanks, Gary. Bye.
Thanks, Andrew, and thanks, Steve. Thanks, everyone.